Welcome learners in this session on nebulization. In this session, we will be learning about what is nebulization, what are the purposes of nebulization, the indications of nebulization, the procedure and aftercare. So talking about the definition, a nebulizer is a small machine that turns liquid medicine into a mist. Nebulization is the most common and easy technique of delivering large volumes of liposomes in the form of droplets to the lungs. In the picture you can appreciate a nebulizer. This is the machine that is used for conversion of medication into droplet form, and these droplets are suspended in air that can be inhaled by the patient. Since the medication goes directly into the respiratory tract, the onset of action is faster as compared to oral medication. This promotes quick relief from symptoms in conditions like asthma. There is no coordination required between the inhalation and actuation that makes nebulizer suitable delivery device for unconscious patients, patients with severely compromised lungs, elderly and pediatrics. Coming to the purpose of nebulization, nebulization serves various purposes like it acts to relieve inflammation of the mucous membrane of the respiratory tract, to soften thick tenacious mucus and relieve coughing, to relieve congestion, to soothe the irritated mucosa, and it causes bronchodilation. Indications. So, nebulization can be used for various conditions like asthma, respiratory congestion as seen in cystic fibrosis, pneumonia, atelectasis of lungs and stridor. There are various types of nebulizers that can be used. Basically, they are of two types, the air jet nebulizer and second is the ultrasonic nebulizer. Talking about the air jet nebulizer first, air jet nebulizers operate with compressed air. These devices have lower output, therefore, more time is required to deliver the liposomes. The second type is ultrasonic nebulizers. Ultrasonic nebulizers operate with piezoelectric crystal vibration, giving rise to high frequency ultrasonic waves to generate aerosol droplets by cavitation. The articles that are required to perform nebulization are a nebulizer with connecting tubes, a mask, medications with medication card, normal saline, cotton swab, sputum mug with disinfectant, a face towel, a kidney tray and a paper bag. Let me demonstrate the procedure of nebulization. So, for this procedure we need a compressed gas source or a nebulization machine, a nebulization kit, normal saline, prescribed medications, a pair of clean gloves, some dressing pads or a face towel, syringes of appropriate sizes and a kidney tray. Wash your hands first, wear clean gloves, now you are ready to perform the procedure. Open the nebulization kit. This is the nebulization kit. This is the face mask and this is the connecting tube. Do not touch the inside of the mask. Open the connecting tube and connect it to the nebulization machine. The other end of the tubing is to be connected with the nebulization kit. Open the respule of the prescribed medication. The medication has to be withdrawn in the syringe . After taking the prescribed amount of drug in the syringe, the medication has to be poured in the nebulization kit. The kit has to be opened. Do not touch the inside of the kit. Pour the required amount of medication in the kit . And close the kit. If the medication is to be diluted along with normal saline, the normal saline has to be poured right in. This kit has to be connected with the face mask . Do not touch the inside of the mask. Once the mask is connected to the kit, turn on the nebulization machine. Let the fumes come. Now this face mask has to be applied over the face of the baby, covering the mouth and the nose. The mask should be snugly fitting over the nose and the mouth of the baby. It can be adjusted using the strings attached to the face mask. The strings should run over and behind the ear. Let the medication finish, and once the fumes they stop coming, we can remove the mask of the baby. While the baby is inhaling the fumes, instruct the baby or the child, if the child can understand, to breathe in deeply and breathe out through mouth. After the face mask is attached, instruct the baby to breathe in through nose and breathe out through mouth. If the child is older enough to understand, explain about deep breathing to the child. After the medication is finished and the fumes they stop coming, turn off the machine and remove the mask from the face. Position the baby comfortably and give a face towel or a dressing pad to the child to wipe off his face. Wipe off the face of the baby and provide chest physiotherapy to the child with the help of your hands cupped. Cupping has to be done like this. It should come over the area of lungs from below upward. Give side lying position to the child. And cupping has to be done. This cupping will help in mobilizing the thick secretions that are collected in the lungs. After giving physiotherapy to the child, ask the baby or the child to cough and spit out and bring the secretions. Offer a sputum mug to the child or a kidney tray can be offered. Make the child comfortable and do recording and reporting of the procedure. Preparation for the procedure. Ensure that the baby has not been fed at least 15 to 20 minutes before the procedure. Switch off the fans in the room where the procedure is to be done. Keep the doors and windows closed. Make the child sit comfortably either on the bed or in the mother's lap. Once the procedure has been done, the procedure can be started by washing hands. Assess and record breath sounds, respiratory status, pulse rate and other significant respiratory functions. Gather equipments, put on disposable gloves as it is a clean procedure. Fill the nebulization kit chamber with medication using a syringe. Position the child in upright position comfortably. Switch on the nebulizer and let fumes come. Attach the mask to the child, covering his mouth and the nose. Instruct the child to breathe in through the nose and breathe out through the mouth. Continue until entire medication is consumed. Reassess patient's status, pulse rate and other significant respiratory functions as needed. Compare and record significant changes and improvement. The aftercare required. Instruct the mother not to feed the child for at least 30 minutes after the procedure. Provide chest physiotherapy. Instruct the child to cough and spit the secretions. Do recording and reporting. Side effects of nebulization. Although rare, some patients have been known to develop negative reaction to the nebulization process like vomiting, tremors, headache, tachycardia and bronchospasm. So, these are the side effects, though rare but may develop in few patients. So, that is all about the procedure. Thank you.